There's a great driving force right now with genetic screening beyond that of science and medicine per se, and that is the economics. It's an area of medicine that's $1 billion industry, and there's increased pressures for this to be done. Number one, pressure is we as consumers of healthcare want a healthy baby, so if this will give us a healthy baby, if it improves our hope to have a healthy baby, I want it done. The second thing is we physicians really want that for our patients, genuinely, and we want to be able to offer it. But the part that really is pressing, that I have more concern about, is because it is a $1 billion industry, venture capitalist interests are now engaging into this field because there are shareholders and they can get a return on their investment. So you have venture capitalists purchasing practices and laboratories and really promoting this heavily because there's profit. And I think that's an issue that needs to be brought to light more so. I've seen in some of the companies that do market genetic screening this sort of an example, and I think it's something to remember as consumers. There's one brochure that I mentioned to a company that I cannot use in my practice. They were looking at women over age 42 and looking at the chance of having a baby if you did pre-implantation genetic screening and had an embryo transfer. And they showed that women over 42 who did this screening and had an embryo put back had a 70% chance of having a baby, which is awesome because over 42, it's usually under 5% per try. I mean, that's just where we've always been. However, the key points are per embryo put back. So I want to give you an example. If there were 100 folks going through this, a woman over age 42, and they went through in vitro fertilization, perhaps 10 of those 100 had at least one embryo with a test result that was normal from the genetic screening. And of those 10 that had an embryo back, 7 got pregnant. And we can argue 70%, 7 out of 10 got pregnant per embryo transfer. But we forgot about those other 90 women that did not have an embryo that had a normal test result or an embryo that even grew to test. So is it really 7 out of 10 or is it 7 out of 100? Truly, for everyone that wants to have a baby, let's be frank, it's 7%, not 70. And it's this sort of misleading information without clarity, without a Consumer Reports perspective, that is driving folks to this technology before it's time that we can really make a huge difference. If folks know that going in, that's fine. But if they're left with that impression, as I've seen in these brochures, it can be very misleading.